Hello. So I interviewed two nurses, one being my mom's friend Courtney and my aunt. So my mom's friend Courtney currently works through Aya Healthcare, which is a major travel nursing agency. And right now she works in the telemetry unit in a hospital in Seattle, Washington. She cares for patients with cardiac issues, post COVID complications, and electrolyte imbalances and renal failure. On a typical shift, she is assigned 4 to 5 patients with daily tasks that include telemetry monitoring, medication administration, wound care, IV management, and preparing patients for diagnostic procedures. Um, Her focus is heavily on the patient education, especially around heart failure, lifestyle changes, and medication adherence. As a travel nurse, um, she takes on the role as an advocate and an educator for the patients. Um, for example, she had a patient who was non-compliant with their CHF meds, and she had to sit him down and explain to him what each med did to help with his symptoms, and why his fluid restriction mattered, and talked through the changes that he was willing to make. A typical day at her unit looks like she arrives at the hospital at 6:45 in the morning for day shifts, and she gets reports from the night nurse, and then she's ready to pass meds at 7:30, and then reviews the telemetry strips and round on the patients to address any changes. And then she normally charts patients in real time, especially after assessments and med passes, to see how they handle and cope with the meds. Um, then she tries to do all the notes before lunch so she can avoid end of the shift crunch, because it normally gets pretty busy. She also works closely with case managers for discharge planning and social work referrals. She's been a nurse for 6 years, and has been traveling for the past three. She earned her BSN at the University of Texas in Arlington. She um, got her license through the NLC and is currently licensed in Texas, California, and Washington. She has like basic life support certifications, ACLS, the telemetry certification, and she's working towards her CCRN. So that's a critical care nurse, and for like ICU assignments. She participates in the AACN, which is the American Association of Critical Care Nurses, and in the TNA, which is the Travel Nurse Association. As a travel nurse, she's like constantly making adjustments, so it's kind of hard. So she says that one important skill to develop in nursing is to adjust to new, or to stay grounded and be flexible in unfamiliar environments is very crucial, especially as a travel nurse. Some questions I asked her about what's the best part of nursing, and she said the best part is helping patients recover and feel safe in your care. One example, she said when one of her patients told her that she makes this place feel safe, so that lasted or had a huge impact on her. And the worst part about nursing for her is seeing patients suffer. She explained a scenario where she was working with a young homeless man post MI and was discharged without stable housing. So just having like a patient get better but then go back into an environment that's not safe kind of upset her. And then how she copes with difficult aspects of nursing is having a good support system like her friends and mentors, and talking to other nurses since they can relate. And the second nurse I interviewed was my aunt. She is a school nurse. She went to Barnes Jewish in St. Louis. It was just Barnes back then. Barnes College of Nursing back then. But she did her schooling through there. It was also an accelerated program, but a lot of her classes were in person. When she graduated and passed the NCLEX and was able to practice in Missouri, she started in the NICU, in the PICU. Then she had a whole bunch of patients that had serious injuries, and it took a toll on her mental health because she hated seeing young babies and young kids suffering and then dying, so that was really hard on her. So she eventually switched to school nursing and went back to school to do grad school at SIUE to get that certification. So right now she currently works in Illinois, where I am from. She works at the Belleville School District. She normally sees 25 patients, which normally include patients who have asthma, like breathing problems, allergies, kids with feeding tubes, diabetics, and then administering medication daily, and then your normal like first aid. Her role as a school nurse is just to maintain the health of all of her students and to follow doctor's orders for tube feedings, care plans, etc. A typical day for her looks like she arrives at school at 8 a.m., prepares all her meds, and charts all of her patients in a computer system called Teacheries, and she's done by 3 p.m. And she also stated that it is really nice to be a school nurse because you have that quick and easy school day, and she gets the summers off. So she really likes that. She's been a nurse for 30 years. Like I said, she went to the Barnes School College of Nursing in St. Louis, got her bachelor's from Barnes, and then continued to get a nursing or school nurse degree from grad school. And then she also has a vision and hearing license or certification from the state of Illinois. Some types of professional activities that she involves herself in is the wellness committee. She's also a certified CPR instructor, so she teaches some of her students CPR as well as like high school students. And then she's also a part of the School Nurse Association, which I thought was cool. She said that one skill or quality she thinks that's very important for a future nurse to have is to be organized and to think quickly. Because if you're in a life or death situation and a kid has like an asthma attack or, whatever, you have to like do something right away and not, overly think about it. And then how she copes with different aspects of nursing. She said that she just leaves everything at school, and she also talks to like friends and family if needed. She said time management's a little different as a school nurse because she gets all of her charting done and it's not super busy like as a school nurse, like running around like a normal nurse in the hospital would be, but she does get all of her charting and everything done before she leaves school and goes home. And then I asked her if there's anything that she would change about the nursing profession itself, and she says she wouldn't change a thing and that she enjoys working as a nurse. And yeah, so that is my nursing interview, and yeah.